Hi guys, welcome to our gross anatomy lecture. Today we are talking about the pancreas, the anatomy of the pancreas. So let's get into it. So right here you see this is your pancreas. It is divided into four. You have your head, your neck, your body, and your tail. Remember, embryologically, the head of the pancreas it was made by the ventral and dorsal pancreatic body that fused due to the rotation of the duodenum. Right. So the pancreas is actually going to be found in the bed of the stomach. Remember, we said there are structures that form the bed of the stomach. Yes, the pancreas is also a structure which forms the bed of the stomach. You understand? So the pancreas is an exocrine and endocrine gland which is used very important in the transport in the GIT and also very important in glucose metabolism and some other mechanisms as well. So you're going to find that the pancreas is involved in the exocrine where it secretes digestive enzymes via the pancreatic acid cells, and then it is its endocrine nature. It's via the isolates of langhans, right, which will be secreting glucagon from the alpha cells, beta cells, insulin, D cells, somatostatin, and all those kind of hormones we take part in the body, right? So we are here to talk about the anatomy of the pancreas. So let's start with the relations of the pancreas. What is anterior to the pancreas? Let's take a look and see. Anterior to the pancreas, definitely we are going to have the stomach. If we remove the stomach, we are going to have the omental bassa, which is that space. And then we're also going to have the transverse colon. Remember, the transverse colon can actually be posterior to the stomach, forming the stomach bed. The transverse colon, its mesocolon, right, and also the superior mesenteric vessels, right. They are actually anterior to a certain part of the pancreas, which is called the antenatal process. So those are the structures that are anterior to the pancreas. What about posterior to the pancreas? So we can actually see that this is your inferior vena cava, and your pancreas is actually anterior to the inferior vena cava. It's also going to be anterior to the left renal vein, left renal artery, and right renal artery. Is it good? Um, so this is gonna be the posterior relations, right? We also have the aorta, the abdominal aorta being posterior to the pancreas. As you can see, you can actually see this liver being posterior to the pancreas. You can actually see, and some part of the suprarenal gland is also posterior to the pancreas. You understand? Good. Now, the pancreas it extends from the C-shaped duodenum, right, to the spleen. You understand? So you have your, let's say it extends from the descending portion of the duodenum to the spleen, and actually most of the part of the pancreas is going to be retroperitoneal. That is going to be covered by peritoneum only in the anterior. But posteriorly, the pancreas is going to be sitting or attached directly to the posterior abdominal wall, except for the tail of the pancreas, which is within the splenorenal ligament at the hillock of the spleen. So therefore, the tail of the pancreas is said to be interperitoneal. While it's the head, the body, the the neck are going to be retroperitoneal. The tail is going to be intraperitoneal. You understand? Let's take a look at the blood supply to the pancreas. Blood supply to the pancreas. Let's take a look. Right. So since the pancreas is formed at the junction between the foregut and the midgut, it's going to have its blood supply coming from the foregut and other part of its blood supply coming from the midgut. What supplies the foregut? The celiac trunk. What supplies the midgut? The superior mesenteric artery. So you're going to have first the splenic artery, the splenic artery, which is the largest branch of the celiac trunk, this one, right, which will be posterior, tortuous, behind the stomach. Remember, it's going to send about 10 to 12 branches. And as it moves on the superior border of the pancreas, it will send 12 to 10 branches, right, supplying the body, the neck, the body, and the tail of the pancreas. You understand? The head of the pancreas, right, which is surrounded by the duodenum right here, is going to receive its blood supply from the superior and inferior pancreaticoduodenal arteries. So if you remember very well, we had what we call a common hepatic artery, which we said it gave what we call the gastroduodenal artery. And it is from the gastroduodenal artery which we got this one, which we say is the right gastroomental artery, which anastomoses with the left gastroomental artery, right? The gastroduodenal artery, this one, it also gave what you call the superior pancreaticoduodenal artery. So the superior pancreaticoduodenal artery is going to give two branches, an anterior and a posterior. So this right here, since we are looking at the posterior view, this is the posterior pancreaticoduodenal artery. The posterior pancreaticoduodenal artery is going to anastomose with the inferior posterior pancreaticoduodenal artery, which is a branch, the first branch of the superior mesenteric artery. You understand? So yeah, so the superior mesenteric artery is going to give some inferior pancreaticoduodenal artery, which are anastomosed with the superior pancreaticoduodenal artery coming from the gastroduodenal artery, which is a branch of a common hepatic artery, which is a branch of the celiac trunk. Easy. So that's the blood supply of the pancreas. Then the venous drainage is actually correspond to the arteries, right? It's actually easy. Some blood will drain into some of this blood will drain in the splenic artery, splenic vein, and it is the splenic vein that will join. You can actually see this your splenic vein that will join the inferior mesenteric vein right behind the body of the pancreas, right, and then behind the neck of the pancreas you are going to have your splenic vein joining your superior mesenteric vein, forming the portal vein, right? The portal vein, the bile duct, and the hepatic artery proper. They are going to be within the hepatoduodenal ligament, which is the free edge of the lesser sac. That is going to be your anterior border of the epiploic foramen, right, going to the hillock of the liver. Interesting, right? Good. What about the lymph? The lymph is actually easy. Since you said that the pancreas is coming from the superior, it's coming from the foregut, and also it's coming from the midgut. So it is going to drain into celiac, superior mesenteric lymph node, and celiac lymph node. Done. What about blood supply, innervation? The innervation, the sympathetic and the parasympathetic of the pancreas, they are both coming from the celiac plexus and coming from the superior mesenteric plexus. Now, I want you to understand this. There are important landmarks that are on the pancreas that are very important that you need to understand. That when you are asked what the pancreas is, you need to know these things. There's a portion called the antenate process. Let me dive you into it. So the inferior portion of your head of the pancreas, we have a process called the antenate process. The antenate process is the part of the pancreas that is posterior to the superior mesenteric vessels, as you can actually see. This is your superior mesenteric vein, this is your superior mesenteric artery. So you can actually see that your antenate process is the part that is posterior, right, to the superior mesenteric vessels, right? You understand? Good. That's an important landmark of the pancreas. Let's take a look at what is inside the pancreas. There are important structures, gross anatomically, that you need to understand, which are inside your pancreas. For example, the main pancreatic duct. So the main pancreatic duct, it extends from the tail of the pancreas towards the head of the pancreas, right? And you can actually see it will be joined by other intercalated, we start with intercalated ducts, inter, intralobular duct, which will later join and form the main pancreatic duct. This main pancreatic duct, right near the descending portion of your duodenum, it's going to join, in most cases, it's going to join the bile duct, right, uh, and form what you call your 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 hepato pancreatic biliary duct, right? And it is this duct that will join into your duodenum via the major duodenal papilla. The major duodenal papilla. Take note, this junction where it pierces the duodenum will be the demarcation of what is below it is going to be coming from the midgut. What is above it is going to come from the foregut. So it's actually very important. You understand? So this major pancreaticoduodenal duodenal um, papilla is actually going to have a sphincter, right, which is called the sphincter of Odd, which will prevent whatever is happening in the duodenum should not go back to the what, to the pancreas and the liver. You understand? We also have an accessory pancreatic duct in most cases that will actually be draining in the minor duodenal papilla, which will actually be above your major duodenal papilla. Right. So basically, um, that is what is important when it comes to the pancreas. So another thing, understand and know that the the pancreas tail is intraperitoneal because it lies within the splenorenal in the splenorenal ligament. You understand? So that's everything that you have to know about the pancreas. Thank you so much. Take care.